Hi, my name is Stefan Kovac, Clinical Educator Emeritus here at Healthmark Industries, and I want to welcome you to our 7 days of continuing education video series celebrating you, the medical device reprocessing professional, and all the hard work you do every day. You could work in a CPD, SPD, MD, RD, CSSD, and endo, a small clinic, ambulatory care, anywhere where you're reprocessing medical devices. This information is for you. Some say knowledge is power. We believe the real power is when we are all sharing our knowledge with others. That's what we're going to do over these next 7 days, is share our knowledge with you, because you truly are the heartbeat of the hospital, reprocessing those medical devices every day, whether they're scopes or instruments or trays or cut down trays, it doesn't matter. You're doing a great job every day. So each day of CS Week 2023, Healthmark will release new educational videos worth 1 CEU. Yep, that's right. 7 CEUs in 7 days, just as a thank you from all of us at Healthmark. Everybody at Healthmark wants to say thank you for doing a great job every day. We want you to keep this in your thoughts as you watch these videos. Remember that you are doing amazing things right now. Build on those successes to make change where change needs to be made. So, how do you get that certificate? It's easy as 1, 2, 3. 1, watch the video. 2, click on the video link description. 3, take the quiz and pass it. It's that simple. But we need you to do one more thing. Please fill out the feedback form so we can continue to improve. Tell us what you want to know, and we will work on providing that information. So now, relax, sit back, and enjoy as we share our experience and knowledge with you. And again, we thank you for taking time out of your day to view the programs we have put together. Have a great CS Week 2023, and remember to always keep it clean. Take care. Bye now.
Hello everyone. Welcome to our webinar, Point of Use Instrument Treatment, Not Something to Pout About. I'm Malinda Elammari, your hostess with the mostest. I am a clinical education specialist for Healthmark, and let's get into it, shall we? Like I stated, full disclosure, I work for Healthmark, and here is our disclosure statement. Our objectives today is going to be to evaluate the impact point of use treatment has on patient safety, define necessary steps needed to provide correct measures of point of use treatment, and describe the impact a lack of point of use has on the integrity of instruments. So why point of use treatment? Let's talk about the effect it has and the effect it has on patients. So here you can see that point of use treatment has been something that has been in our industry literature for a while, has really been rearing its head in articles and news as well. We'll go over that. But you can see here we have a lot of talk about point of use treatment because it's extremely important. We also have hospitals that are showing up in the news because of lack of point of use treatment. So this lack of point of use treatment can be contributed to different situations, environments, but we know that we have situations where we have hospitals where OSHA has come in and fined hospitals because of their lack of point of use, because it not only puts patients at risk, but it also puts your fellow teammates and coworkers at risk. So when we talk about point of use, we really need to understand why it's important by connecting the dots. So when we're talking about point of use can the lack of point of use can increase the chances of contaminated instruments being returned to the OR, increase turnover time, and increase damage to instruments, as well as increase your safety risk to patients and to staff. And when we talk about dirty and damaged instruments, we talk about them possibly being returned to the OR, right? So if instruments are not caught, we are the last line of defense. We get that. If something is missed, it could be returned to the OR, right? And when that happens, we have a plethora of issues that could come from that, like delayed case times, patients under anesthesia longer, infections, tissue damage, excessive blood loss, adverse tissue reactions. So all of these things and then some can happen just from something being missed or an instrument breaking or getting damaged in the operating room. So we have to ask ourselves, what if it was you? What if it was your loved one on the table? Would you want to make sure that your facility is doing point of use treatment correctly? What if it was you who, God forbid, got into an accident and you wound up having to go to your facility for surgery? Would you go? Like most of the time we ask people and they're like, just don't bring me to my own hospital, right? And that's kind of scary. It's scary that you think that way. And so how do we fix those issues so that you are comfortable if anything happens to you or a loved one, you can go to your own facility? So here's some examples of some stuff that we get back, and you all have seen this, right? Like this is nothing new. So some examples of instruments with bioburden on them sent back down to SPD to be cleaned. And at this point, there's a lot of different factors that are happening here and a lot of different things. So we'll discuss those as well further. Or we just get nice gifts from the operating room, right? And so when we get these lovely gifts, you open your gift and this is what you get, right? You open that case cart and there's a nice big lollipop sitting there for you. I'm joking. It's not a lollipop. Please don't eat it. And when we have these situations, we're, staff in SPD are not the ones who are trained to actually remove these. So we wind up having to call the operating room down or the reps to come and remove this, piece of bone or tissue or cement or whatever it may be from this instrument because we're not the ones trained. So therefore, time frame wise, it winds up being longer in the long run anyway. So what does point of use involve? And what does the A team have to say about it? So here I'm kind of showing my age, sorry. So what does the A team say? And I hope you guys know who the A team is because that's really sad if yeah. Anyway, so let's start with Amy. What does Amy say? Amy says that we have to, throughout the surgical and invasive procedure, we have to be cleaning our instruments. So many times we hear, well, I don't have time at the end of the case. I have a turnover. I have this. I have that to do, which is true. And it is a legit concept. As somebody who's worked in the OR, I can tell you there's a lot of pressure for that turnover time to stay in sync and get the next patient in and stuff. And, which the patients want, need to get their procedures done. So, but the point here that is being made is it says throughout the surgical procedure, right? So during the surgical procedure, those instruments are supposed to be wiped and they're supposed to be cleaned, not cleaned, sorry, but wiped and taken care of, flushed, to make sure that that blood doesn't dry on them. Removal of gross soil, disassemble of instruments, and prevention of instrument damage and also containment, right? Making sure we're containing our instruments correctly. What about AST? Association for Surgical Techs also says you want to have them free of debris and blood during the surgical procedure. So once again, keeping them wiped clean using sterile water, moistened sponge. Instruments with lumens should be flushed and not just left with blood caked inside them. Stuff like your reamers and stuff should be placed into a basin of water. That basin should be emptied before transporting, but placed in a basin of water so that it can soak and start breaking down that bioburden on those reamers, which are extremely hard to get off. And then AORN says during the procedure, again, remove gross soil from instrument surfaces, irrigate instruments with lumens, sharp instruments must be separated, protect your delicate instruments, and keep your instruments moist. And then, like we said, those basins of fluid, we need to discard that extra fluid before transporting. And then we have APIC. APIC says also begin at point of use, that preparation for decontamination begins at point of use. And flushing your suctions and lumens, it talks about doing that as well. And once again, during the procedure, so not just waiting until the end of your total hip or the total knee procedure or whatever it may be to flush your lumens, doing it as you go along in the procedure. So removal of gross soil. Saline and instruments, it's a no-love situation, right? They don't get along. So blood and other body fluids and saline are highly corrosive to your surgical instruments and can cause damage easily. The other thing that doesn't get along, the thing that we talked about with saline is that saline is corrosive, right? And so it will start rusting your instruments and it'll start damaging your instruments. So we don't want to use saline, and we want to use sterile water during the procedure to make sure that we're wiping the instruments clean. So 20 minutes is all it takes for blood to start breaking down the passivation layer on your instruments. And we all know 20 minutes in an operating room is nothing. So ensuring that those instruments stay clean. Also, when I used to work in the OR, if you handed a surgeon something that had blood on it, we were doing one of those duck and dive maneuvers because it was coming back at you. Nowadays I think things are a little bit different. I hope nobody's ducking and diving nowadays, but just making sure that we're keeping our instruments clean and protecting those instruments in that investment. All right. Removing single-use and disposable items is another key factor, right? So we always hear, well, the instruments are bloody, the instruments were not flushed or whatever it may be, but we never really talk about removing disposable items, which is all part of point-of-use treatment. That's removing your indicators from your trays, removing liners on the trays and bags if you have them in your trays. Whatever disposable items are in your trays should be removed and thrown away at point of use. And then instruments opened and disassembled. Oh, this is another key one, right? We get trays back and the instruments are all locked, they're closed. You have, hemostats locked together, and then when you open it, they're all bloody, but they're all sprayed. I sprayed them, I kept them wet, but the key aspects that I'm supposed to be spraying are closed with inside that clamp, and I can't even get to them because they're not in the open position. Instruments that need to be taken apart and flushed and sprayed are not being done. They're just, laparoscopic, for instance, the third generation of laparoscopic instruments, making sure that those are taken apart and flushed and properly cared for, also protected. Prevention of instrument damage, right? So making sure that our instruments are protected from being damaged. So, after you're doing your pre-clear point of use treatment, put your instruments back in the container it came in. If you have a rigid scope, put it back in the container that it came in. Identifying your instruments that need repair. If you see something starting to break, if there's something that's starting to break, they should be tagging it in the operating room. It should be from that point. Now, sometimes things get missed, right? But if it's seen, we want to get it as fast as possible. Protect your delicate instruments from damage. Eye instruments, right? Making sure that those tiny little delicate things are protected. And then reusable sharps, segregating them, putting them into, let's say, a disposable kidney basin or some kind of containment that separates it from your other instruments so people don't get stuck, like your towel clips. Heavy instruments on the bottom and lighter on the top, right? We go to the grocery store. We don't pack our eggs underneath our milk. Well, I hope not, right? Because then we get that problem that happens. So we don't want to damage our instruments. And so keeping in mind, making sure that those instruments don't get damaged. And here's an example, right? Point of use is not just about wiping and spraying, like I've been saying. It's how the instruments are placed in, removing the disposable stuff, and truly giving our instruments a chance not to be damaged or broken, right? So you can see the red mat is a set of instruments that was sent up to the OR. That's how every tray was laid out. And then the yellow was how it was returned. So we know eye instruments are extremely delicate. Those need to be placed back into that container the correct way so that we prevent damage. And then we have a flexible scope lying underneath the camera head. And some people might say, well, the camera head's not that heavy. It's not a mallet. But that camera head has weight to it. And even that weight will start destroying the tip of that flexible scope, the lens on that flexible scope. Important to keep your instruments from drying prior to the decontam process. And now there's 3 ways that we can do this. So how do we keep our instruments from drying? We can use a moistened towel. We can wet it with water, place it on top of our instruments to keep them moist. A package designed to maintain humidity. So some type of package that you can put your tray in. Usually you add water to it and then it keeps it moist. Or we have our foams and sprays. So our foams and sprays, for instance, these things, oops, sorry. No, what just happened? All right, so our foams and sprays. The problem with towels is that it does not keep your instruments wet or moist for extended periods of times. It actually, it's on, until that towel dries out, basically. Your packs and your foams and sprays are usually good at keeping your instruments moist for up to like 72 hours or whatever the IFU say for their extended period of time. All right, so point of use with flexible scopes. When we talk about flexible scopes, there's a whole nother section of point of use, right? Because there's a lot of different parts that have to happen with a flexible scope when it comes to point of use, the flushing, the suctioning, all of that, the wiping it down. So we want to make sure that we're hitting those key points when we're doing point of use for flexible scopes. And that starts at the bedside following those IFUs and should be processed and decontam within 1 hour of bedside cleaning. Otherwise, you have to do extended reprocessing. So we don't want to go into that factor, right? And then scopes must be labeled with your time and date of bedside cleaning when you're bringing it to decontam. So, like Mr. T, I pity the fool who doesn't pout. Point of use treatment. So most of you guys will be saying, well, Malinda, like this sounds like a lot of the OR's responsibility. And yes, it is. And the OR does need education. But you as a expert in the instrument field, should be able to educate the OR as to why this is necessary and why it's important, understanding your whys behind it, right? Because if you just tell them they need to do something and you're not really teaching them or telling them why or how it affects you, then it goes in one ear and out the other. So we want to make sure that we are doing our due diligence as those experts in the field, the subject matter experts, of helping our cohorts and our coworkers understand the importance behind what we're asking them. So what's the impact on sterile processing? So when we have instruments that have biofilm on them, for instance, right, and this can happen if instruments are left with bioburden inside them, we start forming biofilm, and then we start getting biofilm on our instruments, which makes it much harder for us to clean our instruments. You have to break through the protective layer first before you even reach the actual contaminant or dirt on the bioburden on the instrument. So if you look at the two bottom pictures, the picture all the way to our left is a toothbrush bristle. So that's one bristle, right? And that it shows some biofilm on that toothbrush bristle. And then the picture right next to it is a zoomed in up close view of that bioburden and what it looks like. So when your dentist tells you to change your toothbrush, there's a reason. Here's the why. All right, it's a dangerous world out there. So we talked about not transporting basins, right? So basins full of liquids can spill or splash on SPD technicians when we're trying to get it out of the case cart or during transportation. Sharps left in your trays can result in serious injuries. Wow. So we all know sharps is definitely a big no-no. So if sharps are left in your trays, we need to make sure we're alerting our management team so that they can call the proper people to come and dispose of those sharps. Excessive tissue and blood can result in slipping hazards and blind spots within trays. So can you see what you're reaching into? Can you see if that's a towel clip or whatever it may be, if it's all covered and caped with blood, right? And we know there are certain departments within the hospital that are famous for sending extremely bloody stuff down to us. So we talked about putting it back, right? A place for everything and everything in its place, right? I'm the OCD concept, right? So even when I scrubbed, I put stuff right back in the same spot on my table. Like I could not stand when things got moved. And my employees, when I managed SPDs, they would come into my office and just mess with me and move my stuff around, and they knew it would drive me crazy. But putting stuff back into its place is for protection of the items, right? We talked about this, right? So rigid scopes. A rigid scope should not be just laying in a container down there like that to bang around, or your cameras or light cords. Our light cords are so fragile. Those light fibers inside them, they're so fragile and they break so easy. They're so much thinner than your hair and it breaks so easily. So protecting our light cords. A lot of times we see people take cords and they will wrap them like basically around their hand and put them inside the case cart. We're just damaging light fibers. We're damaging the inner workings of those cords, those camera cords or whatever. I actually had one employee who used to wrap it around the towel clamp, and the rings of the towel clamp. And, you know, we had to educate that person and say, hey, that's not very good for the instrument or the items. So not putting stuff back also delays, you know, getting stuff back, right? Because then staff have to spend time finding things. They have to search everywhere. What if that tray that has the pieces they need doesn't come out of the washer at the same time with the other tray that they're actually assembling, and it's 4 loads back, and you need that for a turnover? There's so many different factors, right? When just simply making sure that things get put back into their right container. If I have 5 hemostats in my basic tray and 10 in my breast, then that's where it needs to go. It needs to go into those trays. So to that point, when we talk about turnovers, which is always a hot topic, right? How do we get these trays turned over quickly, and making sure that point of use treatment is helping contribute to that quick turnover? On an average, when we did a study at my past facilities, and some other facilities that I've gone to, I did time studies, and on an average, turning over a tray through a full process, a tray can take 3 hours. Now, that is taking into account that there is a washer available, that there's a sterilizer available. As soon as that tray is ready, everything is open and available. That's not if your washers are full, or if your sonic is full, or whatever it may be, those contributing factors. So we've got to make sure that we're taking those into consideration. And then when staff receive items that have like dread on blood and they have to sit there and scrub it, or they're in the wrong trays, it took them almost 4 to 5 hours to turn over a tray. And that's a long time, right? When the surgeon needs those trays and instruments back. So when we talk about point of use compliance, right? So when we talk about compliance, we want to make sure that we're talking about doing things the correct way, right? And so what does that entail? That means putting into the policies what our expectations are of the employees doing the job. So what's our expectations? And then creating procedures. How are they supposed to do this? How are they supposed to accomplish this process? And also standard work, right? So making standard work processes, making sure that, when you do create a standard work, there's a process that you go through, that you're taking in consideration different aspects. So when we used to do standard work procedures, it would just be something quick and simple. And then, standard work forms, it would be quick and simple pictures, not a million words, just quick bullet points of this is what needs to happen. We would test the process, do a PDSA, for instance, plan, do, study, act, see if it works, and then that would move to the procedures, and then also into the policy. So making sure that we have the ability to say, these are expectations, this is what the OR is expected to do, this is what SPD is expected to do, and then we're able to follow through with those. And reminders that point of use in the OR is encouraged. So creating some type of laminated sign or something in the operating room, once again, not a million words. We all have a 1,000,001 posters hanging around, and we pass it every day because it's like loaded with words. People don't want to sit there and read a whole dissertation, right? We just need to get to the key points. And so creating a sign that has pictures and that has, key point aspects on it, easy to see, easy to do, and reminder for those who have to do it. And then auditing, doing some audits of the process, right? So, okay, we've put this in place. We've got these standard works. We've got these procedures. Now, how do we know people are actually doing it? Let's do some audits, right? So let's do, performing random post-case audits in decontam, and help collect metrics, right? So when we talk about collecting metrics, it's not just, I have a bunch of numbers to collect. When you have metrics, you now are able to go to numerical people and say, hey, numerical thinking people and say, hey, the last 100 case cards that we've gotten, I have documentation here that 70% of them were not sprayed versus that goes a long way versus me going and saying, oh my God, you guys never spray anything, right? And then people are going, wait, yes, we do. And so that's where your metrics really come in and are really a key point for fighting these battles that we have to go through, right? And to help educate the OR. So when you're sitting in that OR meeting with, staff and you're trying to get them to understand the whys behind it, we'll also be able to say, hey, by the way, out of the last 40 case carts, only 20 of them had all the garbage removed from them, or only 20 of them had the instruments completely open. So that's a big difference between you guys never open all of your instruments, right? So just taking the time to collect those metrics, having them available and utilizing them, right? And doing those audits, that will help. And then we take those metrics and stuff and what do we do with them, right? And so we start doing quality measures. So if you guys have things like I talked about doing a PDSA, a Plan, Do, Study, Act. If you have something like huddles every day, right? Bring those metrics to those huddles, right? Say, hey, we're doing audits and this is what we're seeing. Stand in the OR's huddle and say, hey, this is what we're seeing. Can you guys please understand and remember to spray? And it's going to take a little bit, right? It's not going to change like that overnight. We need to make sure that we're reminding each other on a continuous basis in a friendly manner that this is what needs to happen for not just patient safety, but also your teammates and staff safety. Another thing that we used to do, and one of my favorite things to do, was called a kamishibai board. It's Japanese for paper play. So basically what it was when we created a new standard work, that quick little standard work form, somebody would take it and audit the process according to that standard work. If the process happened for the day, you would get a green card. If the process didn't happen for the day, there would be a red card, and this would be audited for a week long. I created these yellow cards, which were called konojanai cards, which means not in today in Japanese. And so the yellow cards was just because staff maybe the process doesn't happen that day, right? Maybe that surgeon's not there. Maybe you're not doing a total hip that day, or maybe, whatever the contributing factor. That doesn't mean the process didn't work. It just means that it didn't work. It didn't happen that day. So when we see red cards, it's a way for us to say, okay, we've got a lot of red up here. What's going on with this process? Well, now we've discovered, the OR is not spraying their instruments because there's no spray anymore. They ran out 3 days ago and they don't have any spray and nobody's gotten them. So, that's just an example, but it's really not just about, smacking hands. It's about trying to find out what is the real issue here. What's the root cause of this issue and how do we help fix it? And then meetings, right? Schedule a bi-weekly or monthly meeting. Most of the time, these are already happening, right? So meetings with your infection preventionists, meeting with OR management and stuff, right? Like these kind of meetings happen. But take those metrics to those meetings and have a conversation. And this is where you start, right? Also, if you can get into the surgeons meetings, right? Like, so surgical exec type of meetings where the surgeons meet, like go into those and let's educate the surgeons on what happens in SPD. We know most of them don't understand SPD processes, and that's just because they don't spend time in there. They don't know that process. So let's help educate them. Get on their schedule, do a 20-minute slide presentation, break it down, even if it's 10 minutes. This is what happens in decontam. We don't have to go into the weeds, just an overall helicopter view of what happens in decontam. This is what happens in assembly. The next meeting, this is what happens in assembly. Don't shove it all down their throat at once. When you get the surgeons on board, it's amazing how much everybody else falls under suit, right? We all know that kind of concept. And then the same thing goes with your C-suite and team, your management team, getting them to understand the importance. So we want to track and discuss the metrics we talked about. When we go to these meetings, it shouldn't just be, or we're creating these meetings or trying to establish them. It should not just be for management, right? It should be also the employees or the technicians, boots on the ground, doing the work, so that when we do try to put into place a new standard work process, they're the ones that are like, oh, wait a second, that's not going to work the way you thought it would because of A, B, and C, right? And so just helping them get some clarity and understanding of the different initiatives and aspects that you're trying to put in place as well. And follow the process and reevaluate as needed. So maybe it's not working. All right, this isn't working. Let's go back to the drawing board. Let's start that again. And with that, we are at the end of our webinar. So I hope you guys were paying attention to those stars in those webinars, because that's going to help you with your questions. And I would once again want to say happy Sterile Processing Week. You guys are amazing rock stars, and for everything that has to happen in SPD, really need more recognition. So congratulations and happy SPD week, and see you around.
Hi, I'm Marianne Drosnock, Director of Clinical Affairs here at Healthmark Industries. I'd like to thank you for watching today's CE program. If you got something out of today's video, please hit the like button and then be sure to subscribe to the Healthmark Education channel so you can know as soon as we post more educational content. By liking and sharing our videos and by subscribing to our channel, you are helping us grow. That way we can share the message of patient safety to more sterile processing and endoscopy processing communities, as well as our OR and IP partners. To get your 1 CE certificate for viewing today's video, there is a link in the video description that will take you to the quiz. Just complete the quiz with a 70% or better, enter your name and email, and you will be issued a 1 CE certificate immediately. You can download that certificate right to your device, or it will be emailed to the address that you provided. Thank you again for watching, and we hope you had a great CS Week 2023. Bye.